With the continuous development of modern medicine, Western medicine has gained wide recognition and application worldwide. However, there is a medical system that has a long history and extensive heritage in China and other Asian countries, and that is traditional Chinese medicine, TCM. Despite the significant differences between TCM and Western medicine, it remains a highly effective treatment method with high efficacy and safety. This article will explore the position and role of TCM in modern medicine and compare it with Western medicine in order to help readers better understand the value and significance of TCM. Traditional Chinese medicine, TCM, and Western medicine have fundamental differences in their modes of thinking, which determines the fundamental differences in their treatment methods. This helps us to seek TCM methods to address some of the issues that Western medicine may not be able to solve effectively. First, let us understand these two different modes of thinking. The mode of thinking in Western medicine is science, while the mode of thinking in traditional Chinese medicine, TCM, is philosophy. Science emphasizes empirical evidence and repeatability, relying on strict experimentation and observation. Philosophy, on the other hand, emphasizes logical reasoning and contemplation, relying on a deep understanding of concepts and principles. TCM believes that yin and yang exist in all things and that the root cause of disease is an imbalance of yin and yang. According to traditional Chinese medicine, yin and yang exist in all things, and the root cause of disease is the imbalance between yin and yang. Yin and yang are philosophical concepts in Chinese culture, which run through the theories of various schools such as traditional Chinese medicine, Taoism, and Confucianism, and are regarded as a fundamental way of describing the world. In traditional Chinese medicine, yin and yang are used to describe the attributes and relationships of all things, and are one of the important theoretical foundations of TCM's diagnosis and treatment based on differentiation of symptoms and signs. Traditional Chinese medicine emphasizes the concept of harmony between man and nature, while Western medicine emphasizes evidence-based medical practices. Harmony between man and nature is one of the core concepts of TCM, referring to the harmonious and unified relationship between human beings and the natural environment. Traditional Chinese medicine believes that the human body is a small universe that is inseparable from the natural environment. In the view of TCM, human health and disease are closely related to the natural environment. Therefore, people must follow the laws of nature, respect nature, and adjust their own lifestyles in order to achieve the state of harmony between man and nature and maintain physical and mental health. Western medicine believes that the flu is caused by pathogenic bacteria or viruses, and they will identify a specific pathogen through experiments and treat it with appropriate antibiotics. However, when it comes to viruses, Western medicine's treatment methods are relatively powerless. Traditional Chinese medicine believes that the flu is caused by an imbalance of natural factors such as wind, cold, heat, dampness, dryness, and fire, which leads to the proliferation of pathogenic factors, evil qi, and invasion of the human body. The treatment method in traditional Chinese medicine is to change the body's environment so that the pathogenic factors cannot reproduce or are reduced in the body, thereby rejecting them or living in harmony with them. Here is a more vivid example. Imagine a bottle filled with water and a microbe swimming inside. Without knowing what kind of microbe is inside the bottle, you wouldn't know what kind of pesticide to use. However, there are many ways to kill it besides chemical agents. If we realize that its survival depends on air and water, we can change its living conditions to eliminate it. For example, we can pour out the water in the bottle or cover it with a lid to cut off the air supply. Or we can even build a fire underneath the bottle to boil it. Even if we don't know what kind of microbe it is, we can still effectively deal with it. This means that Western medicine and traditional Chinese medicine have completely different approaches to dealing with the same problem. Western medicine typically treats diseases locally, treating the disease, while traditional Chinese medicine treats the whole body of the sick person, treating the person. Western medicine usually regards diseases as damage to specific organs or tissues, such as heart or lung problems, and then gives medication or surgical solutions for those issues. Traditional Chinese medicine takes a holistic approach, viewing the body as an organic whole that includes multiple aspects such as the body, mind, society, and environment, which are interrelated and interdependent. Disease is the result of imbalances in the body, so traditional Chinese medicine focuses on balancing the body as a whole to achieve the goal of treatment rather than just treating a local symptom. Therefore, traditional Chinese medicine treats the person, not just the disease. For example, in the treatment of cancer, Western medicine adopts an aggressive approach, using surgery, radiation therapy, and chemotherapy to kill every last cancer cell. However, normal cells are often killed as well, and the recurrence rate is high. Traditional Chinese medicine takes into account the influence of the environment, including the internal and external environment, and emphasizes the relationship between the various parts of the body and the environment, as well as the impact of external energy on the body's energy. Here's an easy-to-understand example. Imagine a mushroom growing on a dead tree in a forest. If conditions are just right, such as the right temperature, adequate light, and enough water, the mushroom will grow well. In fact, even if you cut down all the mushrooms, if the environment doesn't change, the mushrooms will grow back. Many human diseases can also have a similar recurrence. The disease can be cut off, but if the body's surrounding environment doesn't change, the disease is likely to recur. Therefore, if we can adopt an integrated approach combining Western and traditional Chinese medicine, we can not only eliminate cancer cells but also change their living conditions, maintain the body, and nurture the internal environment, resulting in better treatment outcomes. Western medicine is based on the summarization of experiments, while traditional Chinese medicine is based on the summarization of experiences. Western medicine seeks out the cause of disease, while traditional Chinese medicine seeks out patterns. Western medicine is founded on the principles of anatomy, physiology, biochemistry, and other basic sciences. Through experiments and observation, it establishes a rigorous system of diagnosis and treatment. Western medicine places great emphasis on the study of disease causation and pathology, and develops corresponding treatment plans through analyzing the mechanisms of disease occurrence and progression. Western medicine needs to identify the cause of a disease before developing a treatment plan. If the cause cannot be identified, or even if it is identified, there may not be an effective treatment plan, and only symptom relief or long-term medication may be possible. Traditional Chinese medicine, TCM, has a history of 2,500 years and is a summary of therapeutic experiences derived from numerous practical applications by the Chinese people over the centuries. After thousands of years of screening, TCM has preserved a set of prescriptions and treatment methods that can be applied based on different patterns of symptoms. TCM's theory is a philosophical system that mainly includes concepts such as yin-yang, 5 elements, meridians, organs, and qi, blood, jing, and body fluids. TCM often does not require knowing the cause of the disease. Instead, it focuses on identifying imbalances in the body and correcting them to restore health. This difference in thinking determines the differences in treatment methods between TCM and Western medicine. Western medicine is confrontational, focusing on the battle between pathogens and antibodies, striving to eradicate them. Traditional Chinese medicine, on the other hand, emphasizes balance and harmony, seeking coexistence. Sometimes we must live in harmony with the disease or pathogen if we do not have the ability to drive it away or eliminate it. Many patients do not die from the disease itself, but from excessive treatment, which is like dying with the enemy. Western medicine focuses on eliminating pathogens and resolving the cause of disease, while traditional Chinese medicine emphasizes balancing the body's environment to maintain health. In Western medicine, each organ or body part is treated separately, and different specialists are consulted for different conditions. In contrast, traditional Chinese medicine takes a holistic approach, treating the whole body. In Chinese medicine, the treatment approach is often tailored to the individual patient, rather than just the specific disease or condition. This means that even if 2 patients have the same diagnosis, their treatment plans may differ depending on their unique constitution, symptoms, and other factors. Conversely, Chinese medicine also recognizes that different diseases or conditions may have similar underlying causes, and thus may be treated with similar approaches. This approach is sometimes referred to as treating the person, not the disease. In traditional Chinese medicine, doctors often do not specialize in specific diseases and instead treat each patient and their unique symptoms individually. This is because Chinese medicine focuses on the holistic balance of the body and treating the root cause of the problem rather than just the symptoms. For example, if a patient has excessive dampness in their body, it may lead to a range of health problems such as skin diseases, respiratory problems, digestive issues, rheumatism, metabolic disorders, and more. By addressing the root cause of dampness in the body, the Chinese doctor may be able to improve several seemingly unrelated health problems at once, thus demonstrating the principle of treating different diseases with the same approach. For example, if someone has a deficiency of yin blood with unclear causes, they may experience symptoms such as dizziness, palpitations, shortness of breath, pale complexion, insomnia, forgetfulness, irritability, dryness, chronic fatigue, and constipation. If they seek medical help from Western medicine, they may have to go through different departments without a clear diagnosis, or they may be labeled with neurasthenia disorder. In Chinese medicine, this is seen as an imbalance of yin and yang, with insufficient yin, and by nourishing and replenishing blood, these symptoms can be alleviated. You may argue that Western medicine can also replenish blood, but the Western approach typically involves blood transfusions or iron injections, which only address specific situations such as acute blood loss or iron deficiency anemia. For patients with yin blood deficiency, this approach does not fundamentally improve their constitution. In general, Western medicine is good at treating organic diseases, while Chinese medicine is good at treating functional diseases. Chinese medicine practitioners often do not specialize in specific fields and treat patients based on their presenting symptoms and overall health. Western medicine focuses on cells, tissues, organs, and systems, but it does not explore much the relationships between organs and systems. Traditional Chinese medicine, TCM, talks about systems, the relationships between the 5 zong organs and 6 fu organs, but it does not focus on specific organs, tissues, and cells. TCM is more of a philosophy and wisdom. Philosophy and wisdom do not have a shape, so they are called metaphysical. They rely entirely on people's perceptions and insights. Science and knowledge have specific shapes and content, so they are called physical. The two are not on the same level and sometimes cannot be compared. Although the ways of thinking and treatment methods in traditional Chinese medicine and Western medicine differ, both have their unique advantages and disadvantages. Traditional Chinese medicine considers the body as a whole and has particular advantages in the treatment of chronic diseases, body conditioning, and enhancing the body's immune system. On the other hand, Western medicine excels in using instruments and laboratory tests, emergency treatment, and surgical treatment. Antibiotics, hormones, and vaccines are the 3 major weapons of Western medicine, while acupuncture, moxibustion, and Chinese herbal medicine are the major strengths of traditional Chinese medicine. The integration and mutual learning of the 2 medical approaches have a positive impact on improving human health. For more knowledge about traditional Chinese medicine, please follow me.